The medical plan provides high-quality coverage for enrolled employees and their eligible family members. It includes comprehensive benefits, including preventive care, personalized support for navigating healthcare, hospital, surgical, and behavioral health benefits, prescription drug coverage, and special features to improve your health and well-being. 2 coverage options are available: a preferred provider organization, PPO, and an exclusive provider organization, EPO. Both options are the same in many ways. They both use the same National Blue Cross Blue Shield network of doctors, hospitals, and other healthcare providers. Both provide 100% coverage for recommended preventive care when you use network providers. Both provide personalized support for navigating healthcare. Both cover the same types of medical care and treatment if you are sick or injured or diagnosed with a health condition. Both give you the freedom to see any network specialist without a referral. And both give you access to the Employee Assistance Plan, or EAP, Call to Health, and other benefits to help you improve and maintain your health. Even though they're similar in many ways, PPO and EPO are different in 6 important ways that impact your costs. The first difference is network coverage. Only the PPO covers out-of-network care. Out-of-network means the provider does not participate in the Blue Cross Blue Shield network. With the PPO, you may use out-of-network providers and receive benefits, but your out-of-pocket costs will be higher. The EPO does not cover out-of-network care except for emergencies. So, when choosing an option, you'll want to check if your doctor is in the network. The second difference is costs. There are 2 types of costs you should consider: the monthly cost for coverage and the costs when using your benefits. First is the monthly cost for coverage. Your employer will tell you the costs for PPO and EPO coverage, and your contribution is deducted from your paycheck. Generally, when you pay more each month for coverage, you pay less out of pocket when you receive care. As you consider choosing PPO versus EPO, ask yourself whether you prefer to have more money taken out of your pay in exchange for lower costs when you visit the doctor. The other costs you need to think about are how much you will pay when you receive care. In other words, how much will you pay in the form of copays, deductibles, and coinsurance under each option. The third difference is copays. With the PPO and EPO, you'll pay flat dollar copay for primary, behavioral, and specialist office visits, as well as urgent care visits and teledoc. For the EPO, copays also apply for basic diagnostic services like X-rays and outpatient lab tests, advanced imaging like CT scans and MRIs, physical, speech, and occupational therapy, and chiropractic visits. The fourth difference is deductibles and coinsurance. For covered services that don't require a copay, you are responsible for paying the deductible and then coinsurance. Both options have an annual deductible. Under the PPO, the deductible amount is based on a percentage of your effective salary. Under the EPO, the deductible is a flat dollar amount. Under both options, if covering your family, you are responsible for 2 deductibles, one for yourself and one for all of your family members combined. Also, for both options, you can qualify for reduced medical deductibles next year by completing Call to Health. Once you've paid your deductible, coinsurance kicks in. Under both options, your coinsurance is 20% when using network providers. The fifth difference is out-of-pocket maximums. Both PPO and EPO protect you from catastrophic costs by placing a limit on how much you will pay out of pocket in a year in the form of copays, deductibles, and coinsurance. This is called the total maximum out-of-pocket amount. Both options have the same total maximum out-of-pocket amount. The PPO also caps the amount of coinsurance you will pay for covered medical expenses in any one year, and has a separate cap for eligible prescription drug expenses. The EPO does not have these limits. The final difference is prescription drug coverage. Both the PPO and the EPO use the same drug formulary, which is a list of preferred medications chosen for effectiveness and cost. However, there are differences in coverage, except for certain excluded drugs. The PPO typically covers medically necessary drugs that are not on the plan's formulary, although you'll pay more out of pocket for these non-formulary drugs. The EPO, on the other hand, does not cover non-formulary drugs. If you take any medication on a regular basis, make sure the drug is a formulary drug before enrolling in the EPO. Remember, it's important to think about the big picture of your healthcare spending when choosing between PPO and EPO. Instead of simply picking the option with the highest or lowest monthly contributions, consider how frequently you use healthcare services during the year and the type of services you need. Do the same for any family members you plan to enroll. Not sure which is the right plan for you? Visit pensions.org/medical for more details about the PPO and EPO, or call 800-PRESS-PLAN.